Okay, Sir AK, can we start with the questions on wheezing? According to Chinese medicine, what causes wheezing? I don't, I cannot hear your voice. Nako, ano ba yan?
Wheezing is caused by exterior pathogenic influence, and when the phlegm and the congested lung obstruct the airways, it becomes the wheezing sound as air passes through the phlegm.
Okay, so basically, what is the problem here?
Uh, the exterior pathogen doc, and it causes the obstruction.
Does the condition of the lung have something to do? Like, because basically, when you talk about wheezing, you expect the accumulation of qi in the chest, diba? And that will not
Yes, doc.
happen if the lung is functioning normally. So let's talk about the pathology of
Definitely, doc. It caused by lung qi deficiency, and also the Wei Chi is weak.
okay.
That's why the exterior pathogen will penetrate in our body, in our lungs.
Okay, because the lung qi is unable to descend or diffuse. So this is what makes the qi in the chest accumulate, no? So
Yes.
basically this is a situation in which the qi would accumulate in the chest. Why? Because the lung qi fails to descend or diffuse. Good. So let's talk about excess wheeze. Okay, what causes excess wheezing? So you were talking about the
Expose
pathogen
This
earlier.
is caused by factors as wind cold and with heat,
Okay,
or delayed treatment, or external factors, doc, like pollen, dust, smoke, polluted air.
okay. So it's basically the pathogen. You mentioned this
Yes,
earlier, no? So it could be wind or phlegm, or usually they're together. And this is the one that's causing obstruction and and constriction of the lung qi. That's why it's called
yes.
excess wheeze. Good. Okay, what about deficiency wheeze? What
Uh,
causes
defi-
it?
mm-hmm. It due to weakness, doc, of the lung. Also,
Okay.
the weakness of the kidney.
And
Uh,
there's
it will
another
happen
example. Yeah.
also in the chronic illness condition or
So are we just talking about the lung?
constitutional weakness.
Are we only talking about the lung and kidney? Is there any
Yes,
other,
doc.
did you fail to mention the spleen? No?
Uh, yes, doc. Also, the spleen is a very responsible organ
Mhm.
to process the fluid in our body,
Okay, so
to
basically we have
transform.
conditional factors that includes the lung. So if the lung qi is weak, uh, it cannot diffuse or descend.
Yes,
Another
doc.
is the spleen, which is the organ that has the same polarity as the lung. This will produce phlegm. So if you have spleen qi deficiency,
Mm-hmm.
you produce phlegm, and this phlegm clogs the lungs. And
Yes,
lastly, you mentioned about the kidney qi.
the kidney,
So if the kidney qi is deficient, it will not be able to grasp the lung qi.
lung chi.
These are the three conditional factors that are causing deficiency type of wheeze. Great. Number four, what are the main causes of wheezing?
Uh, there's main causes of wheezing. First, the exterior pathogens attacking the lungs. Second is the improper diet.
Okay,
Uh, Also the constitutional weakness
very
of
good.
the body.
What else? Would you not include also emotional factors? Do you
Yes,
think?
doc. Yes. The emotional factors, uh, the grief, emotions,
Yes. Okay.
it will affect
Anything else?
the lungs.
Anything else? Because as a practitioner, you have to have a very broad understanding of the possible etiologic factors. So you mentioned constitutional factors, no, then deficiency,
Diet.
the diet, external pathogens, and emotional factors. Perhaps you would want to include overwork or
Yes, doc.
exhaustion,
The overwork.
diba?
It's
And
an
also
external factors.
the environment and your habits.
Yes.
Okay. What are the treatment principles for deficiency wheeze?
First, we need to support the righteous chi. Uh,
Okay.
to tonify the chi, the lung chi.
Okay.
Also to warming the yang,
Mhm.
okay? And also to nourish the yin,
Good.
the spleen, the lung, and the kidney chi, to tonify the three organs are
Yes.
the key.
Good. Very good. Okay, let's talk about cold phlegm in the lungs when you have kidney yang deficiency. I think you will agree with me that kidney yang deficiency can actually bring about cold phlegm in the
Yes,
lung.
doc. Yes.
So can you tell me how are you going to treat such
Uh,
condition?
First of all, doc, when it comes to cold phlegm, we need to warm the lung, okay?
Okay.
Tonify the yang, also to disperse the cold, and
Um,
the principle of transforming the phlegm.
wouldn't you warm the kidney instead? Because
Yes,
if
doc.
you take a look at the question, it's secondary to kidney yang deficiency.
Okay.
So that's why you have cold phlegm. And we all know for a fact that the lung and the kidney, they're like mother and son. So
Yes.
if the son is the main cause of the problem, in this case, there's kidney yang deficiency. So I
Mm-hmm.
would rather probably treat the kidney, or you were saying warming the lung. So I think warming the kidney would be a better option. Diba?
Yes, doc. Kidney yang is the overall. We need
Okay.
to warm, because this is
So
the overall treatment.
yeah, perhaps what you should focus on is how to direct the chi downwards. So that's basically
Mm-hmm.
strengthening the lung chi, right? Direct the chi downwards. You have to stop the wheeze, you stop the cough, and then you have to be able to do something about the cold phlegm. You have to
Cold phlegm.
transform it. So you were correct, Park. Yeah,
Yes.
but
Okay.
since this is secondary to kidney yang deficiency, then you need to do warming of the kidney first. Okay. Number seven. Um, this is a very easy question. What is the your treatment protocol for lung qi deficiency?
Uh, Lung qi deficiency, first, we need to tonify the lung qi, and to consolidate the defensive qi or the wei qi,
Very
uh,
good.
to prevent from the outside or the exterior pathogen.
So aside from strengthening the lungs, you have to tonify the general qi. Is that what you're trying to say?
Yes.
Yeah. So that would also include strengthening the qi of the spleen and the kidney, diba? Number eight, what is the main consequence and manifestation of a chronic spleen qi
Mhm.
deficiency wheeze? Remember, you have a wheeze that is a chronic thing.
Basically, doc, this is the problem of the spleen. They cannot transform the fluid. Uh, and transform.
Oh,
And because of that, it causes the more phlegm inside to
yes, very good.
accumulate
You
the
got it
phlegm in the
right.
lungs. Okay.
That's what I wanted you to answer, phlegm. Brilliant. What
Produces
is
many
the
medications.
difference between wheezing and dyspnea?
Wheezing, wheezing, uh, difficult breathing with accompanied by sounds, whistling sound, doc. And dyspnea is shallow and rapid breathing, but without whistling sound.
So, are you trying to say that not all patients with dyspnea will have wheezing?
Yes, doc. Yes, definitely, doc.
Okay, very good. So it's all about the location of the pathological factor or the pathogenic factor. Both
Mm-hmm.
will have breathing difficulty.
Yes, doc.
All patients with wheezing will have dyspnea, but not
Mm-hmm.
all patients with dyspnea will have wheezing.
Yes, correct,
And
doc.
wheezing is primarily a lung pathology, while dyspnea can be because of pathology outside the lungs. Okay, very good answer. Number 10, your last one. Okay, if the patient will ask you, what foods will I eat or avoid? Okay, in other words, what are the dietary factors that will weaken the spleen and lead to wheezing? Because we wouldn't want to have wheezing anymore. If,
Okay.
so, if the patient will ask you, what will you answer?
Definitely first, drinking cold water,
Okay,
first in early in the morning. Uh, Excessive consumption of salty and sweet, sour,
okay.
and also the greasy foods. Okay, can impair the spleen organ.
What about alcohol? Do you
Yes,
think,
definitely, doc. Alcohol also.
mhm, how will alcohol contribute to wheezing?
Mm,
I think you know the answer. Can you lose the five element theory here? So we all know that alcohol is it hits the liver, right?
yes, doc.
So the liver is supposed to be controlled
Mm-hmm.
by the lung. So do you
Mm-hmm.
think the lung is affected if you drink too much alcohol?
Definitely, doc. Yes.
So are you saying that this can um, weaken the spleen as well?
Yes, doc.
Okay. Thank you very much, Sir
They're related.
AP. You did
Thank you,
very
doc.
good. Thank you so much and congratulations.